hours, I will be talking to you about critical informations regarding to job opportunities. And this presentation is going to come about as a result of the current job climate. I'm sure a lot of you have seen the numbers of statistics running around, what information is going out in the news, and there are quite a numbers of empirical evidence. I'm sure many of you here, you've probably applied to jobs and you've had unfortunate outcome from those job application, either at application process or at interview process. And all those things are things that actually shape your future outlook in terms of opportunity for yourself. And just like every one of you here, at some point I've been an undergrad and I've equally been, I've gone through my postgraduate and I've gone through my job search phase. That doesn't mean I've stopped searching for job, but I'm in a position now whereby I can influence discussion when it comes to job opportunity, particularly for university students or people that are non-university students that are looking for job in any capacity. And that is what I will be talking to you about today. And it's quite very important now, particularly given that a lot of the universities today do not actually give you the necessary information needed in order to succeed in the job market. I've experienced it myself. And I know what it feels like when you come out of universities and you're left on your own to go and figure out your future. The career service within a lot of universities are not doing enough to help improve a lot of the undergrad to make them the kind of to make them ready for the job market. And what I will be doing today is to show you how to plan your future, how to plan your career, and what is the right time for you to start actually making the necessary plan, and also give you insights into the informations where a lot of transferable skills can help you identify key roles for yourself, and when is the right time to actually start making progress. And do not ever underscore yourself on the basis of thinking that look, I don't have experience in here, or the requirement of this job might mean that I would not put forward my applications. There are numbers of things that will determine the success of your applications beyond just your academic attainment. And these are the things I will be talking to you about over the course of the next few minutes or hours or so, which you will be here. So thank you so much for coming. Right. So can I just ask, can everyone see my screen? Can you see my screen? Yes, great. Thank you so much. Right. So just to make mention to you that a full disclaimer I want to put out there, that I am not speaking on behalf of the NHS. I'm not speaking on behalf of any NHS trust. I am speaking to you on behalf of my own independent capacity. And I will tell you the genesis of how we got here today from my own point of view, where I am. So I am not speaking to you as a recruiter, as an NHS recruiter, and I'm not speaking to you in the capacity of promising you a job. I'm only speaking to you in the position of trying to um, give you some information and help you overcome some of the critical barriers that could actually shape your job prospects. So over the course of the next few hours, I'll be talking to you about, understanding NHS and the system itself, understanding career pathways into NHS and NHS job families. How do you actually categorize job application within the NHS? I'm sure when you go, as we go on, I will take you through the website. You will see thousands of jobs on the platform. And sometimes you get confused in terms of how to sort of, categorize these jobs. What are the key elements and important statement that needs to go into your application in here to best represent you, to show that you're the right candidate for the job, or even at least give you an opportunity for interview in any capacity. And how do you prepare yourself for the event ahead of you? Because a lot of you actually are actually not, you've not really prepared well enough to understand that your university does not even count as any phase in your career in any capacity. The impact of social mobility in your career progression cannot be overemphasized. And this is something I will be talking you through, and also shed some light into some of the implications of things you will experience as you go into the job market, particularly around the interview cost, around relocation, and what is your actual career plan as well. And understanding NHS interview techniques. So the NHS interview techniques are very, very bespoke. Different jobs within NHS have different interview requirements, and they will expect you to come with at least some 80 to 95% of understanding of the question in order to succeed as the right candidate when you put yourself forward. And the major factors in here, which we're going to be talking about, the cost of living is something that has been talked heavily about in the news since COVID. And you would have experienced that either as a student in many ways, and you would have seen your parent talk about how things has become expensive. But what you will also see as well is that the numbers of job you will be going into as your first job, if you're actually being realistic, might not actually mirror what your expectations may be in many ways. And in any other capacity as well, you might also find yourself in a situation whereby the salary you will be getting, you will still need additional job.
Hello, sorry.
Sorry, please make sure you are on mute. Yes, you will also you might find yourself that when you get your first job, you might also need another set of jobs to help you to stay afloat, to have a reasonable disposable income whilst you're actually doing your main full-time job. So all those things are something you need to understand as you go into it. And NHS is not one of the highest paying institution. There are numbers of reasons for that. There are numbers of compensations that makes it in that way, particularly around the pension. But there is a banding at which you arrive at when you get into NHS or you pursue a career in NHS, when you start to have a sense of decent income, particularly around having enough disposable income. And disposable income in this case is income that is left after you've paid all your bills, house rent, solve, your day-to-day bills around telephone, electricity, whatever you have left to spend on yourself is what I'm talking about in terms of your disposable income. And you get to see some testimonials from numbers of candidates I've worked with. I have some of them here today. One person is here today. But again, you get to hear, see numbers of incredible testimonials from people I've worked with and how that has shaped their career from that mentorship I've given them and I continue to provide to them as well. And then we have opportunity for question and answer. So, who am I and who is the person sitting in front of you today? Perhaps some of you would have received my email, which is the invite email I've sent out. Just to make mention again, my name is Oyetayo Said Agulwaje. I had my college. I moved from Nigeria at some point in my career because my parents would not bring me here for schools. So I came here towards going into college at the end of my secondary school, going into college. And when I was in college, I did typical A level like everybody else. And I went for my undergrad where I studied politics, philosophy, economics from University of Hull. And in between that, I had a very brief stint working in a bit of consultancy and various other jobs as well. I then went on for my master's where I read international business and management from Sheffield Alum University. And since my master's degree, I've, so moved there from private sector, pivoting to the NHS, particularly from public sector point of view, where I've had opportunity to take on different roles as operational manager within division of medicines, working specifically within endoscopy departments. I then went on to become head of department within division of surgery, women and children. These are the within surgery services, and currently I work as the head of service within surgery and plant care in one of the leading hospitals within the Southwest area. So I've been in the NHS for a very long time now in different capacity, and I've seen how, as a recruiting manager myself within the NHS, and as someone that is from ethnic minority, I've seen how, the differences when it comes to interaction, and I've also seen at first hand the level of disparities between ethnic minorities, opportunities in leadership capacity within the NHS. And this is one of the reasons why my major driving force today is about trying to see how we can close that gap, improve inclusivity within the NHS, improve recruitment opportunity, and also shine lights, especially from people from highly underrepresented background, bring some light into the opportunities available to them. And that is one of the reasons why I have been pushing these webinars across various organizations at charity level, academic institutions, and also within the community as well, in order to provide information that our community, every underrepresented community, do not know about and what opportunities are there for them. So, I having worked in the NHS over the years, I then went on to I had opportunity briefly to participate in various mentorship programs with my university at Sheffield Hallam. I then decided to translate this into a key program where I started delivering webinars to university. I set up the company about 2023, put it at a professional level. And the aim was, empowering job seekers of all grades to secure meaningful career within the National Health Service. And the work I set out for the company is about expanding opportunity to underrepresented communities with the aim of strengthening diversity, opportunity. Because one of the statistics I will give you today that might sound a little bit heartbreaking is when you look at the NHS, if you look at the demographic, the workforce demographics in there are numbers of compositions that makes it quite difficult to read. If you look at it, for example, at the band 2 to about band 5 level, you see the ethnic minorities overrepresentation in that band. But when you start to go from your band 6 onwards, you start to see the decline in ethnic minority representation. So why is that always the case that ethnic minorities are not well represented at higher senior managerial roles within the NHS? There's something going wrong. Either there is level of asymmetric information, meaning that people are not getting the right level of information that could encourage them to pursue those career, or people just think they will not never fit in. And until you put yourself forward, you will never know where you fit in. And this is one of the reasons why I am here today to speak to you, even though you're still a student or even if you're a graduate. I am telling you, you can do it. And I am a very classical example for you. And I'm trying to assure you that with the level of work and dedication and commitment, you can achieve it if you want to. So, but there are numbers of work you need to do in order to be able to achieve that attainment that you're looking for. So what is the approach that the company prior and future career consulting takes? It is centered on helping candidates to build a clear, achievable pathway into the NHS, having a realistic expectation, securing your entry role. And many of you will start at entry role rather than junior managerial position. And in many cases, if you're an international student, you're able to get sponsorship as well if it's important to you. And the best way we've been able to do this is by delivering practical, innovative, personalized strategies that simplify job seeking opportunity for you and equips you with the right tools that you need to succeed at your interview. Because one of the things that will also come to light is, a lot of you would have attended various NHS interviews or interviews in various capacity, and you never understand why you're never chosen as a candidate until you realize where your mistake is coming from. So the strategy we've deployed over the years is making sure that there's a proper career mapping to identify suitable roles and progressions routes for you within the NHS and helping you with your applications and interview preparation so you can fully understand what is expected of you and how do you achieve that, and giving you that ongoing mentorship and guidance to build your confidence, resilience, and long-term career readiness. And this is one of the most important part of it because you might think your appraisals and one-to-one are designed by your manager to help you to progress. But if you're actually very realistic, this is not something that will happen. And I will explain why to you. You could imagine a situation where a manager has recruited you, you've gone into the role, you're now working for them, they've trained you, they've invested in you heavily. And seeing that kind of investment being put into you, you just expect that you can wake up one day and then you want to move on to a higher role that is not within that same department. That is a massive loss to that manager because they have to go through that process with another candidate. So they will only train you to make you competent to the best of the capacity that you're useful for them. And that is where the problem comes in for you, because you might felt like you're stuck. And this is one of the reasons why a lot of people leave their job once they become stuck. But for you to be able to have someone out there giving you continuous guidance, continuous mentorship, continuous evaluation of your performances, giving you that information to help you understand where your next career opportunity might come from, is something that you will get with someone like me or the company, helping you to make sure that you have the right career mapping and show you the necessary steps you need to take to achieve your promotion. And this is about working with you collaboratively to give you the right information so you can navigate that recruitment processes, and giving you all the necessary training materials you need that will prepare you to your next developmental goals, particularly around promotional roles. And if you're home students, particularly someone with British citizens that do not require sponsorship, that is probably about 60% of your worries out of the way, is because the next thing you just need to fight for now is compete against existing internal staff members, which then you probably might be choosing because they probably don't want those people in those roles because they know their capacity, and then they want fresh blood, someone with new ideas and new insights into that department to help them to turn things around. And that might be your first opportunity to come in there to help turn things around and then build your own experience and build your own career along that line too. So if you look at the impact over the years, our work as the work that has been done through myself and a couple of people I work with, we've increased employment rates for underrepresented job seekers. If you go on the website, and I'll show you numbers of testimonials, how the support has been there for people of ethnic minorities to go into roles that are, in many cases, they've considered to be beyond them within NHS. They've gone on to achieve those roles. It takes a lot of hard work, grafting, and quite some very painful experience, but they did achieve it. And they made a very good prospect for themselves. And you also will see, improved access to various mid-level and senior managerial roles as well. And likewise as well, in terms of the impact, enhanced social mobility. The fact that people now understand that in UK today, for you to be able to have any sense of achievement in any capacity, you have to take the impact of social mobility. And what does social mobility actually mean? Social mobility, in its very simple, broad term, is the fact that you have to leave your current destination or current location or current residence to move to different areas in order to take up the opportunities that is there as part of your career development. And that is something that I want every one of you to take away from this session. If anything, the fact that, let's assume whatever age bracket you are today. But I'm just trying to say to you that as you're growing into your career, or as you're coming out of university, or if you're already out of university, you need to be heavily prepared for the fact that your current area or where you reside might not provide you any future opportunity in terms of career or career progression, and you might need to move across different areas in the country, perhaps within England, in order to be able to achieve something for yourself with as quick as possible. Therefore, by doing so, we've been able to bridge the gap between talent and opportunities and help to create more diverse, resilient, and representative NHS workforce. And that is true. And I'll show you the evidence as we go along. So, what am I talking to you about today? I'm talking to you about NHS. And a lot of you, when you hear about the NHS, the first thing that comes to your mind is this whole idea of doctors, nurses, and various clinical areas, people. You see the ambulances, and that is what everyone sees what the NHS is. And you see the building, and you just think it's all about doctors and nurses. No, there is more to NHS than these. There are numbers of highly skilled administrative roles within the NHS that requires administrative support for all these clinical roles to function effectively. And for all each individuals of these roles, so I'll give you an example within the NHS. For example, if you have the departments like a very good example will be ENT, which is ear, nose, and throat department. Within that same department, there are numbers of administrative staff that will be there. There will be the head of service, there will be the general manager, possibly there will be operations manager, there will be performance manager, there will be a receptionist in there, there will be someone that is responsible for booking patients in there, there will be someone responsible for managing the clinics, there will be someone responsible for reporting faults in any capacity. And all these individual roles have different job titles attached to them. And these, in some circumstances, will be the entry role, which you will then use to propel yourself. And a very good example as well, when you've been to your GP and you've been referred to the hospital, your GP being the primary healthcare setting, the hospital being the secondary healthcare setting, there is someone responsible for managing that referrals. That is also another administrative role within the NHS, albeit a quasi-clinical expectation, but you can learn about it if you're actually dedicated and understand what it actually means for those roles. So when you hear about the NHS, the NHS itself is not just about doctors, nurses. Without the administrative staff within the NHS, the doctors and nurses cannot function effectively in any capacity. So the NHS is a comprehensive healthcare system, and it consists of various healthcare providers, facilities, unions, regulators, and services. And it's not just limited to hospitals, the shiny buildings you see. It's not just limited to that. It's not just limited to the ambulances you see on your streets. And if you look at it, you don't actually even have to work in the hospital to actually be attached to the NHS. There are numbers of various organizations you can work for that one way or the other will directly connect you into the health service operation. And if you look at them, for example, you have the hospital at the heart of it as well. And then you have organizations like NHS England, you have organizations like NHS Property Services, you have the NHS Supply Chain, NHS Digital, NHS BSA, which is the Business Service Authority, responsible for managing all the pensions, the pays in NHS really. You have NHS Resolution, you have the ICB, you have NHIR as well. You have NHS Confederation, you have the National Institute for Clinical Excellence, you have the CQC, which I'm sure a lot of you have heard about, you have the UK HSA, Health Service Authority, you have the Health Union. So amongst all these, there are numbers of various organizations that I've just listed out, and all these are even the small numbers. I've not even talked about the UK Research and Innovation, which is another very important organization when it comes to job opportunity. So when you look at all these, for example, let me just take you through the health union, for example, and just follow me with the names I will be giving you. So within the health unions, I'm sure you've heard a lot of strikes that has happened within the NHS over the last few months. And if you look at the health union, for example, what are the unions that are readily available there that you can also even get a job with them? You have the Royal College of Nursing, for example, which I'm sure anyone from a little bit of clinical knowledge would have heard about them when the strikes for the nurses were happening. You've heard about the Royal College of GPs as well. You've had the Royal College of Psychiatrists, Royal Society of Medicine, Royal College of Physicians, Royal College of Midwives, Royal College of Paramedics, Royal College of Paramedics, Royal College of Radiologists, Royal College of Pediatrics and Child Health, Royal College of Pathologists, Royal College of Occupational Therapists, the Royal Society of Public Health, of Cancer Research, Chartered Society of Physiotherapy, Microbiology Society, Infection Prevention Society. These are health unions which I've mentioned to you that represent all these bodies within the NHS. And you can see if you go through each individual website of all these organizations I've listed, you will see various administrative job opportunities there that one way or the other does not necessarily mean you're working in the hospital, but directly come to link you to work in various capacity from NHS point of NHS point of view. And all these agencies, like I've mentioned, provide a lot of exciting and promising career prospects. And for you seeking your career growth, that might be the best way for you to start, albeit if you want to move into the hospital setting in future. And there are plenty of roles, administrative management roles that you can pursue. And if you're actually in that phase of your career, seeking out what you want to do next, if you're a recent graduate, if you're just about to graduate, this is the best time to start planning yourself. And let's look at the NHS in numbers. When I talked about social mobility, let's look at NHS in number, for example. There are at least counting, there are 1,250 fully functional hospitals, both acute, community hospital, and non-acute hospital across England, for example. And of that, there are 1.5 million workforce, both clinical and administrative. And so far counting, there are at least 100,000 plus vacancies within the NHS, a combination of clinical and non-clinical role. And this is despite the fact that a lot of hospitals have frozen job vacancies. And with those tightness as well, there's still massive level of vacancies. People are constantly leaving their job. People are continuously retiring. People are getting redeployed because of sicknesses. People are leaving their role, creating jobs opportunities, which they are looking for new set of talent of people to come in and then make the role viable and one whereby patient care can be delivered excellently. So you as a student or as a graduate or someone seeking job opportunity, how do you know your own career pathway into the NHS? Where do you start? And these, sorry, looking at this diagram, it might apply to you at different stage, but it's all still boils down to the one key part of it, which is job opportunity. So if you're a student, my best advice to you, which I wish I had that information when I was a student, but yes, I'm thankful to the position for where I am today, is you should actually start working at least within the NHS, either part-time in one capacity or the other, whilst you are a student. Because what that does is allows you to start building that experience, that career experience, and that career pathway development for yourself right whilst you're studying. Because one of the things you will actually realize is as much as your education is important, your educations cannot supersede experience. And this is why you will see in many circumstances where you will be interviewed with someone that do not have the same level of qualification or attainment like you, because they've been able to build their experience, solidify their experience, therefore giving them that home advantage over you when it comes to experience over qualification. Therefore, their experience actually automatically invalidates your own qualification because they've worked over the years in that sector, and then they can speak excellently well about the critical criteria. So my encouragement has always been, and this is something I find quite depressing with the universities, is to encourage you that whilst you're studying, you need to understand the importance of actually taking on work responsibility as well. Even if it's a 10-hour, 15-hour or 5 hours job opportunity that you're doing in there, even if it's a volunteer role, pick it up and then you take on that role and use that as opportunity to start building relevant experience for your own personal development. And by the time you're walking straight into your dissertation phase, if you're still a student, you should start giving yourself at least 3 to 4 months thereabout to start looking, making a plan, a career mapping plan to say, okay, I'm coming now to the end of my academic program. I'm going into my dissertation phase. If I'm not going for my master's, how do I go into the job market? If I'm going for my master's, how do I still get a job that will allow me to carry on working while studying? And then possibly towards the end of my master's, I might be able to go for my 6 and a band 7 role that will then give me a very good career prospect towards what I'm working forward to. And by the time you're graduating, my best advice is the day you drop your dissertation, in the case that you're not an international student, the day you drop your dissertation, as you're dropping your dissertation, going back into your dorm to pack your stuff or go back to your parent house, you should actually be going that same Monday, the Monday following that, majority of time your dissertation is dropped halfway through the week or by the end of the week. The Monday going into that, you should be going straight into your full-time role, converting it from part-time into a full-time role. And this is something you would have done whilst undertaking your dissertation. And if you're an international student, you probably want to go into your sponsorship phase, which will happen after 6 to 7 months after you've been in various roles, and then you start moving up the ladder. And if you're not an international student, you probably want to do one job for at least about 9 to 10 months and then start seeking a promotion opportunity. It is always advised that you don't stay in a job more than about, let's say, worst case scenario, no more than 12 months. Now, you might ask me the question that does that not have a different perception when the manager is looking at your applications? Who cares? Why do you care about what the manager thinks? What matters to you is you've been in a job for 12 months, you've developed yourself, you've learned about it. What's the next target for you? If your first entry role is a band 3, okay, I've been here for about 12 months. I think I know my I know my job now. I know what the NHS entails now. I know what I need to do to succeed. I want to go on to my band four, my band five now. And if that band for your current band three is somewhere in Nottingham and your next band five is in Manchester, if you think you're able to do that relocation, put the application forward to Manchester and then move down there, do your band five for about another 10 to 15 months again, and then move to another area for your band six and your band seven. And you do that, give yourself, have a proper plan of about 24 to 46 months plan and use all those timelines to establish critical point at which you're going to start your application. Albeit, give yourself at least a solid 1 month application, 1 month interview process. Or if you're very fortunate, you could be one of those people that pass out every first attempt. If it's a case whereby you still need more than one or two interview, it is also possible that you will pass at some point. So you give yourself a period of about 1 to 2 months going through that interview process, and then at least solid 3 months you've taken out of your plan is determined for application, interview, and then relocation if needs be. If the opportunity comes within your trust, that's fine. If it doesn't come within your trust, just make sure that you are open-minded to the possibility of relocating to different areas. And then when you get to a position whereby you feel more stable or you think you've done enough for yourself at maybe about six or about seven, whatever position you find yourself, you might then take a pause from constant relocation, or then focus your job targets towards the area you currently reside. If you've established yourself in a way whereby relocation becomes difficult, either due to family reason, maybe you've now become married, you've had children, or you've settled down as a result of mortgage commitments, whatever that position may be that could in that the social mobility, continuous social mobility, then you have to be very practical and tactical in terms of your application process. So, when should you actually begin your application, which I talked about briefly? Your application should begin immediately, ideally before you depart your home country if you are international students. Let's say you are home students and you're already here. Literally, my advice will be for second year, you should actually even have a part-time job that will keep you going, carry on allowing you to build your experience. Do not get carried away by the student exuberance, the student lifestyle, um the lifestyle that come with being a student, the various social events, from various clubs or parties that happens every Wednesdays or Thursdays, thereabouts. So do not get carried away. There's more to life after universities, and it's quite very difficult. And I can tell you right now, the job market, even within the NHS, is absolutely really, really, really tough. And I'm using the word really, really tough to emphasize it in such a way whereby I'm trying to make you understand what the current job climate is. Even if you look, by the time I take you through the job search in NHS, I will show you some of the things going on. A lot of jobs now are literally, as I'm speaking to you, fixed term position. You hardly come across any permanent opportunities at the moment. And this is the nature of the current job market. And it's very, very competitive. A very good example I'll give you. I am fully aware of a job opportunity in one of the hospitals in London where they had received 300 applications for a single role. And that is the current situation of things. So you have to be ready and to be prepared for what the new current job market looks like for yourself. So, like I mentioned to you, around 5 months before graduating, start exploring progressive roles within the NHS and then start looking for opportunities of higher banding. And then planning early helps you to align your skills, your document, and experience with the role you aim to secure. Also, make sure you target the right role. Just don't apply to job randomly. Don't go to estate and facilities, then don't start working in estate and facilities, and then start looking for roles in different areas. Have a very, very well aligned, thought through process of what role do I want to go into, and when I go into that role, what sort of training do I need to do to progress myself? If I'm going into this role at a junior level, the person managing me in front of me, what makes them unique? Nothing. But the next question you should be asking yourself is, what are the things they've had to do to get to where they are today? Can I also do that as well? If it's something, if that department or that area is where you want to continue, then you need to build a career around trying to work towards that same attainment. And that will require a series of trainings and opportunity. Therefore, within 15 months of completing your study, you should aim for, if you're someone looking for sponsorship, you should aim for a band 6 role in London in order to attain sponsorship, and band 7 role outside of London. But if you're not looking for sponsorship, give yourself a reasonable time so you can start moving up the ladder in that regard. So, what do you need to do right now to design your career pathway? First and foremost, know that there are numbers of free platform websites that offer training with NHS trainings, various trainings um, on NHS various systems that will give you insights into what the jobs are, various jobs when you start categorizing them entails. Some of them require you to have NHS accounts, some of them do not require you to. But if you're very fortunate to have even started working in the NHS and you have NHS email, so if you look at organizations like NHS Select, for example, they offer a wide range of training focused on staff development, particularly those of you that will be going into various leadership roles, things like minutes taking, reports writing, emotional intelligence, mapping, what's it called, stakeholders engagement. And if you look at NHS QIL, which is the quality improvement learning, this is a training, this is a platform which represents 80% of what your NHS jobs usually covers, particularly those of you going in areas of things like patient pathway, medical secretary role. You get to have insight into how patients are referred into the hospital from your 2 weeks wait, from cancer diagnosis. All these information sits within your QIL. And the NHS Leadership Academy is another very, very important one as well. And the NHS Learning Hub, which is a very free platform, any one of you can sign up with your Yahoo or Gmail. If you don't have NHS email address, you don't need it. And then you can go and do series of training like safeguarding. You can learn about pathway. You can learn about all sorts of opportunities within the NHS. So the Learning Hub is a free for all platform that any one of you can sign up to. And when you're making your application, you can document these into your application, which then will actually even help you as you progress yourself. So before you pursue or before you make your application, it is very important to understand the NHS job families and the application process. So I will walk you through some of the critical aspects of NHS job families. Let's look at the key one that we're going to be talking about here. So there are jobs that are purely administrative roles within the NHS. So if you're looking at jobs like a business support officer, administrative support officer, PA, those are purely administrative roles. But once you start going into jobs that are quasi-clinical, you're starting to look at jobs like medical secretary, you're looking at jobs at patient pathway coordinator, you're looking at things like bookers, schedulers. These are jobs that have a little bit of quasi-clinical element to it. And what do I mean by quasi-clinical? They are not fully clinical and they are not also fully administrative. So they have a combination of expectation in these roles that they at least expect you to be able to understand things like, the patient pathway, patients that are DNAs, so patients that do not turn up for their appointment, why did they not turn up? Providing those reports, understanding the implications, patients that are breaching their waiting time. So you have to have a little bit of training in order to, or training of very critical willingness to learn in order to understand the key functions of those roles. And those roles, if you don't actually represent yourself well on your applications, definitely your applications is not going to come back positive in any way. So there are specific things they are looking for in your applications that you need to achieve to be able to meet the requirements for that role. And I will walk you through some of those processes now so you can see what I'm actually talking about in various capacity. So just give me a second. So um, I guess you can still see my screen. Yeah. Everyone, can you still see my screen?
Yes, I can say.
Great. So now we're looking at setting up your track, and this is where I will be going into details around your application process with you so you can understand what I am talking about. So just give me a second. So here we are. Um, can you just give a shout? How many of you are familiar with these websites? How many of you are familiar with these? Great. Anybody else? Yeah, Oluwakemi. Yes, Sunday. Anybody else? Yeah. Great. Solomon. Yeah. Wonderful. 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 So seems like quite a few, and very good representation of people here are familiar with these websites. So that's good. That's good. So quite a lot of you know these websites. So this is where a lot of Tonya as well. That's very good as well, Tonya. So a lot of you actually know where NHS jobs are literally advertised. But there's two platforms. There is this platform and there's also Track as well, where jobs are advertised on Track as well. But the reason why I prefer these, I will tell you the reason why I prefer to use this platform. I'll show you some of the key advantages I find with using the nhsjobs.uk instead. So when you come to the nhsjobs.uk, you can do a lot of filtering that allows you to actually categorize the kind of job you're looking for. So without using a specific prompt, so let's just say I've come into NHS jobs and I decide to click on search. Automatically it just gives me about 12,354 jobs, and I know definitely not all these jobs are going to fit into, so I have to make sure I filter the jobs out. So I can then decide to say, okay, look, I'm living in Birmingham. Why don't I just look at jobs available to me in Birmingham? I'm living in Bristol. Why don't I look at jobs available to me in Bristol? I'm living in London. Why don't I look at jobs available to me in London for now? And I can also look at hospital specific, for example, to say these are the hospitals I want to look at for now. I'm going to look at these hospitals around me. Let me see if they have job opportunities. But you can go to those hospitals directly. You can go to their website and look at their vacancies. But one thing I can do if I'm going nationwide, for example, which I have done, and then it's brought to me 12,354 jobs. Now I know that, okay, look, this is my current state of play. I am someone that I still don't have a lot of experience. Perhaps the best entry role might come from a band two, band three, band four. You can then filter the kind of banding of job you're looking for. And then what I can do is I can apply the filter. All of a sudden, it's reduced the job now down from 12,000 to 1,752. Now, if you're a student, what can you then do? You can then decide to go to look at various jobs like permanent, fixed term, which you can also look at bank, which is like agency for you. You can look at secondment as well. And then you don't need to look at the pay grade because it wouldn't make a much difference. So, but what do we look at? We're looking at work pattern. So if you're a student and you're looking for a part-time job, you can focus on a part-time job share, flexible working, home or remote working. And then you can, let's say I apply the filter now. Let's look at where we are. So now I'm back to 1,114 jobs from 1,007 thereabouts. So I'm now left with about 1,014 jobs. I can then decide to say, look, I'm looking at the newest jobs, or if you're someone that is looking for immediate response, let's say I'm focusing on jobs that will be closing immediately, because once you apply, these jobs are going to be closing today or they will be closing by Monday. So by the end of the week, one way or the other, they would have done the selection and then let you know if you're going to be invited for interview or simply if your application has been unsuccessful. So in this case now, I'm starting to look at jobs that I want to go for, and you can see that a lot of the jobs I've actually preached again, particularly the many jobs, many jobs where a lot of ethnic minorities tend to go for, like the housekeeper, healthcare assistant role, are those that have come up first, are the kind of banding I've been talking about. But what we then look at is you can see this job as a team secretary, for example, in West London. And you can see that this is about a band three role and it's closing on the 7th, which is tomorrow. So you can see the kind of jobs now. You can see another job, patient assessing West Mersey and West Lancashire, for example. You can also see trauma, you can see receptionist within the trauma services, and there's opportunity for flexible working. This is another part-time job as well. This is also another part-time job which we're going to be looking at very soon. So you can see this one, for example. This is University Hospital Birmingham, administrator coordinator, clinical personal assistant, and this is a part-time role, which, let's see how many hours these jobs have to offer us in any case. So it is 18.75 hours per week. So this is probably you working But give and take, if you work 2 days, that is 15 hours. So you'll probably spread your hours out over the course of God knows how many days which you will be working. And if you're very lucky, you could actually have to spend your 2 days working on weekend alone, Saturday and Sunday, which actually even works well for you. So you can see now the numbers of part-time roles that are there. Look at these as well. Clinical team administrator. So how many hours are we looking at for this role? This is 22.5. So this is a job of 3 days. So this is a job of 3 days. So 7.5, 7.5, 7.5 over the course of 3 days, which I don't think is too much to ask. And in that case, you can see is a 12 months fixed term contract, which definitely by the time you've done this kind of job, you've built your experience. So if you're a student, as you are in here today, you can see very much well that within the few minutes I've been searching for job, I've been able to come up with various part-time roles that are available within the NHS. And I've not even gone in depth into looking at full-time role. Again, this is another set of roles I've shown you. University Hospital Birmingham, full-time band for MDT coordinator, which we're going to come into. So you can see clearly that there are numbers of opportunities available to you. It just depends on how you position your application and how you search for it and what you're actually aiming to achieve from it as well. So that is the strategy you need to be preparing in order to make sure you can make success for yourself. And if imagine you're a student and for whatever reason you've been very fortunate, you've started working at the band three within the NHS doing part-time, and it comes to about 4 to 5 months before you graduate. And definitely you're looking at somewhere between band four, band five. You move on to a band four right immediately after your graduation. And 10 months into that role, definitely there's nothing stopping you from becoming a band six because of the wealth of experience and knowledge you've built over the years. And that is the way, that is one of the best strategy that allows you to be ahead of the curve, especially when it comes to your friends that you will be graduating with. That puts you way ahead of them. And one thing you should never bank on is to assume that because you're coming out with a first class, you're destined to get a job. You're not the only person coming out with a first class in your university. Not to talk of you being the only person, you're not being the only person coming out with the first class across the country. And whatever university you go, sorry to break the news to you, your university, whatever university you may go, you will be competing against highly qualified, well-represented universities where there are networks and connections. So, very good example in here today. You'll be competing against people from Cambridge, Oxford, LSE, Loughborough University, and that is the market you're going to be going into. But how do you make sure you stand out as a candidate? That is through you yourself making sure that you include experience, you incorporate experience, or you build experience as you're also studying. And that is what puts you ahead of the curve. And that is what makes a difference when it comes to your career success. And that is something I want you to keep with you as you follow me today in this presentation. Um, right. So we're then going to look at, what makes our application successful in any capacity. And that is something I'll be talking to you about when it comes to the reason why you're applying, details of relevant experience, trainings, and, your personal attributes. So, for example, I have picked a job in here today, which is a patient administrator in Chelsea and Westminster. These jobs have series of requirements that they want someone to have. A lot of you will probably have it in many ways. So at least they require a GCSE English or equivalent, which you probably possess. Ignore the NVQ, office administration, or similar experience. If you have an undergrad degree, that is way ahead of NVQ in many ways. And then A levels English and Maths, definitely you have it. Even if you've not studied in UK, there is way qualification. Your qualification is ahead of that. So experience working in administrative capacity, I'm sure one way or the other, whether you're in universities, the numbers of things you've done that might give you that administrative experience. But you can also tell them, even if you've not had that experience, that you have a strong can-do attitude. And that can-do attitude is what they're looking for to give you that opportunity. And again, you see, for example, they put it as a desirable and essential. So in some circumstances, please ignore all these things. I can bet you that in some cases, the manager don't even know what is in the application. They just want someone to come in front of them and show them that they have knowledge of what they need, having read the job description. Now, one thing though that you will not be able to escape from is your IT skills, and that is things like your IT skills and technical skills. So they've asked him here knowledge of access policy and RTT pathway. These are technical questions that you will not have knowledge of unless you have someone guiding you or you've actually even studied them beyond basic level for you to be able to know what this means. And I'm not sure if, with the exception of one person in here, I'm not sure if I were to ask any one of you, what does RTT stand for? I'm not sure there's anyone that could easily come outside and give me a basic definition of what they know RTT to be. And these are the kind of questions that will catch you out in your interview, and you'll never be able to understand where the unsuccessful outcome is coming from. So you need to be willing to know or to get the support or guidance from someone that have those information so they can help you to develop. So we're now going to look at these now. So we've identified our application that we're going to be using is the Chelsea and Westminster. That's what we're applying to. Now, you're going to have to answer some of the basic questions at the beginning of your applications. What do we need to look at in here? Are you currently employed by them? No, you're not. Are you currently an employee of other organization? If it's the case, yes. If it's not the case, no. If they tell you that they are looking for internal candidates, your application will be automatically rejected. You have to choose a visa status or immigration status that applies to you. If you're a student, you might want to give them some comforting information at the bottom here to say, look, I am rounding up my academic program. I'll be switching to a postgraduate visa, or I'm still on a student visa. I still have 24 months to work. So I do not necessarily require sponsorship to work in this role. But let's assume everyone in this room is a British citizen to a greater capacity. And then what do you do next? You go on to your, give me a second. You go on to continue. So now, what you're going to get now is this, right? The the system. So this is what you're going to get, right? So the system is going to ask you to answer some questions. When you set up your track account, your details would have been imputed in there anyway. You would have been expected to put all those details in there before you can get onto a position where you can get to this point. But when you get in there, you have to provide all your details in terms of where you live, your whereabouts, and what applies to you in terms of the kind of jobs you're open for. And when you go next, you then talk about, do you have any relationship with anyone in the hospital, which you need to provide them either yes or no, subject to the criteria that best fits it with you. And again, you have questions around criminal record. Clearly, do you have any offense that you've committed? Remember, you cannot lie on any of your application, because when a DBS is carried out, if it transpires that the information you've given them misrepresents you, they have the right to withdraw that application from you or the job offer. And this is where majority of your application is determined within the 7 seconds. When they see your job, they can know if they want to hire you or not. And this is where you start looking at your academic qualification, your universities, and the grade. You have a separate space where you input your training, relevant trainings you've attended. So, for example, things like safeguarding, if you participated in any training through your universities or any program you've attended. And now you start coming here to talk about your experiences, who has been your employer, their address. They will need all this information, and in order to help them to be able to determine where you fit in. And this is very, very important. Why are you leaving the role? Is it because of a career progression, desire for a career progression? And in here, I've seen cases where people just write a very simple 1, 2 lines about their job description. Put as much information in there so whoever is reading it can see how well you fit within their organization. What kind of information they're looking for? Let's say you're working as healthcare assistants. You probably want to put in here things like manual handling. You want to put in here medication administration, monitoring of the patient vitals. You want to talk about collaborative working. If you have an administrative work through your university, you want to talk about things like leadership. You want to talk about collaboration. You want to talk about event management, statement. You want to talk about some of the critical things that you can actually talk about at length in your supporting statement that fit in well with the applications you're about to make. And this requires you to detail as many applications as you've made. And then you come in here, which is where your 1,500 word supporting statement needs to be provided. And this 1,500 words is also similar to what you have with your personal statement that you submitted to UCAS when you were making your application for the university. But these again needs to be very bespoke. Different jobs have different requirements for supporting statement. Once you have a category of job like the one I'm showing you now around your patient administrator, patient access administrator, medical secretary, patient pathway coordinator, bookers, schedulers, those roles I've mentioned to you, they have critical importance to them, which is the patient pathway. And this is where they want to see in your application things like, information on referral to treatment, document that talks about the patient pathway around the 28 days, 30 and 32 days, and 31 days, and the 62 days referral to treatment. And also, things like the patient tracking list, managing DNAs, identifying patient breaches, and various IT software that you will need for this role, like Excel, ability to analyze data, cleansing of data, data correction, and going forward into that as well. Some of the critical aspect of the job is about confidentiality. And from NHS point of view, they're looking at things like the Caldicott principle, UK GDPR, and likewise as well, abiding by the local trust policy. So can you see how I'm already focusing on that is actually in relation to the job? And if I'm applying for very specific administrative role, I want to talk about things like, empathy, communication, managing meeting, report writing, all those critical things are actually very much specific to this role that you will need to write about. And if you're doing the same for any pure administrative role, like a business support officer, they will need you to have excellent minutes taking, report writing, at least ability to type about 60 to 70 words per minute will be very, very essential for you to be able to participate in meetings. And once you've done that successfully well, I can guarantee you one thing for sure, whether you like it or not, I'm not saying that job will yield a job offer, but at least I can say to you, if you follow the advice I'm giving you, definitely you will be sitting for an interview in one capacity or the other. And in some circumstances, they will ask you some additional questions. Some hospitals we ask you for questions like, they want to write about your other experiences, but in this case, they don't need that. And this is the most important, vital part of your application. When it comes to your references, a lot of you have not done a lot of work in making sure that you keep good contact with people that are your referee because you believe you've left that organization or you've left the university, you no longer need them. That is not the case. These are people that you will continuously need until you no longer need them. And I don't see the reason why you should not need them. Please build a very good rapport with your lecturers, build a very good rapport with people that have employed you in the past, and try to avoid a situation whereby getting a reference from them will become difficult. And the reason for that is because if the recruiting manager struggle with your reference, and it's not one of those jobs where there is a room for risk assessment. They have the right to withdraw that job offer. So, in order to help you to build a good referee record, make sure you maintain good contact with your lecturer. An academic reference actually helps you very much in terms of which you might actually underestimate. And then anyone that has employed you in the past, you will also need a reference. And for the reference for NHS, please realize that NHS will not accept the Gmail or Yahoo references. They need a professional organization reference in order for those references to be valid. So make sure whoever you're going to be providing them are people that have an official email address, not Yahoo and not Gmail or any social email in that capacity, and you need to provide all the record. Now, the reference might also be a case whereby you're still working with them, even though it's asked you when does this reference covers for. Just put in there, if it's a case you're still working in there, just put in there, for example, December 2026, even though you're still there, and don't worry about it, they will sort that out themselves. And that is something you need to know. And taking you into then you have all these your equality question, which is about your sex, which is about disability, your date of birth. In any capacity, if there's any situation whereby any one of you might have a disability that you might feel like is really, it might hinder you or impact you when it comes to your interview, please don't be shy to disclose it. Please do disclose it. Within the NHS constitution, you are expected to be given a reasonable adjustment if your disability have a major impact on your social on your well-being and life in general. So that please make sure you disclose your disability so they can know where reasonable adjustment needs to be made when they do invite you for interview, and the rest are just your typical questions that we ask you. And that is something you need to provide them when it comes to writing your supporting statement. Talk about your leadership quality, your IT knowledge, talk about your ability to work under pressure, talk about your knowledge of various documents you've read, things like, referral to treatments, you've been from primary healthcare setting to the secondary healthcare setting, all the necessary government targets when it comes to referral to treatment, and then talk about their trust values in the applications as well, and see how you see yourself representing those trust values when you're working with the patient. And if you can build these over at least five to six paragraphs of about, say for example, one of the things I do when I'm doing the 1,500 words writing, for example, which is similar to like an assignment in university. Let's say I'll take about 200 words, for example, will be for my introduction, and I'll put another in the middle in there, myself, my experience. I might just put in there. So 200 words for my introduction. Let's say I put another 300 for my about myself and work experience, number one, and also academic attainment. I might just put another 100 words in there for academic attainment. So give and take, that's about 600 words. So out of that, I have about another 300 words to talk about my leadership. And then what does that take me? That takes me to 900. And then I'll talk about my IT skills, another 300. That takes me to about 1,200. And the last maybe 100 words, 150, I'll use that to summarize all my skills and, how I see myself fitting into the role, the trust values, all those things. And you see how I've been able to achieve the entire 1,500 words in about 5 paragraphs or so, putting those into, sections by sections of what I need to write. And that is how I get to the position where I want for across my application. And if I'm able to design that application template for this kind of role, anytime applying to this role, I just need to change the job title. I'm not writing another supporting statement. And that is the cheat code which you need to know, which a lot of people don't know, which is why they get exhausted when making NHS application. Because you believe every time you're making a new application, you need a new supporting statement. That's not the case. You just need a very good supporting statement that covers everything I've mentioned, and then you roll that out across this particular set of application, and then the rest is history. Just watch how your interview flows in. And there are numbers of people that I've worked with in here that can testify to that. So let's go back in there. I will be sorry, by the way. Um, Thanks for your patience. I'll be giving you time to ask questions. So just bear with me. I don't want there to be interruptions, therefore, making me to lose um my thinking line of thinking in any way. So that's why I'm actually just making sure I deliver the webinars, then open the floor for questions. However, with all these things I've mentioned to you, what are the events ahead? This is what a lot of you have not prepared for. And I did mention it at the beginning of the presentation. And this is where a lot of people run into a lot of challenges when it comes to job searching. So what do you need to know? There are several challenges you need to anticipate. And I am very, very sorry. If you do not anticipate these challenges, you probably struggle to get a job. Let me first and foremost mention to you interview cost. Interviews, whether you like it or not, they do come at a cost. Whether you're going to be traveling there or you're going to be canceling your shift. Rarely do you get to be interviewed on weekends. So if you're getting interviewed on weekdays, you already know how expensive it is when it comes to train commutes if you don't drive. And you also realize the fact that you have to cancel your shift or take holiday from your work if that gives you the opportunity to do so. So my advice is whatever you do, whether you're getting student loan or student finance to support you, or you're someone that is working, make sure if you know you're searching for a job, make sure you're always keeping at least about 50 to 100 pounds aside in one pot account that you have no access to. Open that account, throw the bank card away, or give it to someone that will never give it to you in any circumstances until you have a genuine reason for that money to be made available to you. And once you keep those money there, that is actually should be kept aside for your interview. And the reason why I'm saying that is on average, you can predict that on average, if you are having 2 interviews every week, imagine you have about 6 interviews in 3 weeks, 6 interviews in about 3 weeks, which is two in every week. That means you will be spending close to, if every of your interviews is away from your house, let's say you're spending about 70 pounds to go to each individual area. That has not included the commute from your house to the station. It's not also included the fact that when you get to that area, you still need to commute to the areas from the train station to the hospital as well, either by taxi, depending on the time of your interview. And let's say you spend about 70 pounds. Imagine 7 times 6. So let me do the rough calculation for you. So you're going to about 6 interviews. So 70 pounds. So that is about 420 pounds on average for interviews. If you're not very fortunate to pass at first attempt, you can see that you have about 420 pounds to spend on interviews alone. And that is something that is the new reality, and that is the truth which you need to prepare yourself for. And then goes on to the fact that, if the job is not within your current environments where you live, where your current residence is, if you're living with your parent or you're living by yourself, you might also still need to relocate. So the choices are now that, do you stay unemployed because the job is not around your area, or are you willing to take that massive step of relocation in order to start a career, which might mean a different start for you? So if you see people saying to you for the past 3, 4 years, 5 years, they've been unemployed, one of the major interests is the fact that, the relocation challenge is not something that they're willing to jump. And this is where you will start to experience it at first hand. If do you want to stay 3 years unemployed, possibly claiming benefits, or do you just want to take that massive risk and then move to different areas? I mean, I'm sitting down here today to give you this presentation, and I will not pretend by saying to you that every time I've worked or where I'm working is anywhere close to where I live. I've had to move all the way from London down to go and work in Great Yarmouth, around Norwich, from Norwich down to Mansfield, from Sheffield right into different areas. And that has been my career so far. And that has helped me in many ways as well. So you have to see the current state of society for what it is, that um, you cannot jump that part of your life in terms of when it comes to social mobility. Or in many cases, you can settle for a lower role within your area and then hinder yourself from career opportunities that could come with it. And again, there's potential loss of income for some of you that have agency work or jobs that only pay you when you show up to work, which is a pay as you earn kind of contract you have. There will be a loss of income in addition to additional cost you will incur from going to your interview, which means you have to cancel your shift so you can attend that interview. Not a lot of interviews at a certain level will give you opportunity for virtual interviews. Therefore, you have to cancel your work. And there's also a direct implication in here that in some circumstances, if the agency tend to see you that you cancel a lot of shifts, there could be an implication that you could be seen as unserious. So in the case of you trying to find something better, you could also still lose what you currently have that is feeding you. So you have to be tactical and strategic about the way you want to position your application. And that is the reality of what you will be facing, whether you're coming out of university, whether you're out of universities, and whether you're already whatever sort of visa you are on. This doesn't have anything to do with your immigration status. This is something that is applicable to everyone, irrespective of immigration status. And this is something everyone needs to be prepared for in order to achieve the desired success. And I'm sure the picture in the presentation represent what I'm talking about well. So yeah, so this is something that is not that is not really the situation I'm describing is not exclusive to one specific group of people. And yes, we've come now to the part whereby a lot of you, the reality will start to dawn on you. So you've made an application, you've you invested heavily in writing a good supporting statement. What next now? Interviews are coming in. What I want you to understand is different NHS interviews, different NHS band of different grades have different interview requirements. At the band 2 to band 4, your questions are not very much so much technical and heavily loaded when it comes to competencies in terms of, high level expectations. They will expect you to have knowledge of the role, things like, say, for example, the patient access role I was talking about, your knowledge of the role in terms of managing core, empathy, respect, supporting senior management. They will expect you to have knowledge of that role, but not at a very broad level. They will expect you to have knowledge of the trust values, which will be compassion, and how do you see those values representing you. There will be questions around your suggestions that you've made to improve service. If you're a university student, there's probably something you've done that you could talk about. Conflict management with colleagues and confidentiality, which I talked about, things like the Caudical principle, using confidential ways to dispose of any confidential material that is no longer required, not sharing patient information recklessly over the telephone, verifying the identity of who you're speaking to know if they're the right person that should be having access to that information, and how you work with people like your county court guardian within the trust when there is data breach. So those things are things that will feature in your interview at the band 2 to band 4. They are quite very straightforward in this capacity. But when you start to get to your 5 and your 8, your 5 to 8 onwards, that is when you start to experience quite very broad interview requirements, knowledge of the role, not at the superficial level. They're talking about, what are the category of people they see in this role. They're talking about things like, say you're going for an interview of a service manager within ENT or urology. They will start to ask you about things like, what do you know about our waiting list? What do you know about our waiting time, breaches of patients? What do you know about us as an organization in terms of our NHS league table? They want to see what you know about their waiting time, how they are performing, what experience can you bring in to help reduce their waiting list, and things around performance and policy. What are the recent NHS expectations, particularly how do you improve performances around our waiting list? How do you improve staff performances in terms of one-to-one appraisals, working collaboratively with HR and Learning Academy to develop training program? Budgetary responsibility, the financial constraint on NHS right now has made budgetary expectation at the center of almost every interview questions. They will want you to demonstrate that you have knowledge of opportunity to bring about cost improvement program, achieve cost improvement program, efficiency savings. Those things will need to feature well when it comes to your communication, the technical terminology they will be looking for, and then goes into your leadership qualities. What kind of leader are you? Being a democratic, transformational, and what does those qualities mean? How do you coach a team? How do you improve morale underperforming team members? How do you provide a one-to-one support? How do you adopt your leadership skills to a situation you find yourself? How do you go from being someone that is a democratic to someone that give a dictatorial, authoritarian approach? How do you take accountability? How do you build accountability within your team? These are leadership qualities they want to see. The ability to make sure that you're very fluid when it comes to adopting a different leadership strategy depending on the situation you find yourself. And then the last part of it, which is about collaboration with senior manager. Are you the kind of someone that can take instructions and help them to communicate very difficult situation to junior staff? How do you represent them? Or are you going to be someone that actually is going to be competent as a senior member of the staff that will not allow the senior manager to bring about any effective change? So how do you communicate very difficult change to team members? Because you're going to be the face of the divisional lead for your team, and your responsibility is your loyalty to your team, and at the same time, how do you balance your responsibility to the divisional lead in helping them to deliver critical service? So those leadership qualities is what they want to see from you, and this is something you need to communicate in your interview. And if you don't have that experience and ability to communicate it, then definitely someone other than you will be getting the job, and these are the kind of skills you will need in order to be successful as you progress to your role. And you can see series of things that are very much important when it comes to interview tips. For example, learning about the organization, its culture, and the job. You sell yourself, eagerness to learn, provide examples of achievement and skills. Again, find the right balance. Talk about, take time to think about the question. Just don't assume you understand the question. If in any case you don't understand the question, there's nothing wrong in you asking them to repeat it, by the way. And then also, be honest, give a genuine, honest answer. There are times whereby you can see when someone is making up an answer and someone that actually is giving you an answer from an experience. I'm sure you can read, but if you're an interviewer, you can read body language and you can know who's giving you those answers. And again, manage difficult times. So you can see some of the critical things that are required when it comes to your interview expectation. But above all else, this is where the challenge is going to come into it, right? And this is something I want all of you to take into account. And I've been discussing with you here today regarding where do you go when it comes to making success for yourself. Now, for you to be able to achieve this success, I know there's something you need to be aware of, your pay. And this is one of the biggest questions when it comes to NHS. NHS staff are highly underpaid. Um, there's no question around it. And you don't start seeing any material benefits in terms of income until you start to get to about band 6, band 7. Um, no matter how good you are with money. And because the higher you go, the more likely the location you will be moving to will require additional expenses from you. And you can see, for example, when it comes to NHS, obviously, there's been a bit of pay increments. So NHS Band 2 do not. So this is the 26, 27 pay I'm looking at now. So you can see that the Band 2 position no longer have the need for steps in them anymore. But at the Band 2 level, what will your take home look like, for example? So let's say we are looking at NHS Band 2 in England. You have zero experience, which you don't need to. Do you work in London? So let's say you don't work in London, for example, you work 5 days a week. This is your tax code. That's your NHS pension. If you're a student in here, as many of you are, you probably have one thing in common. You probably have a student loan. Let's say you have a plan one student loan. So this is what your pay will look like, for example. That is your full take home at the end of the month after working 37, so that's 70. So after working 150 hours, that is if your job without any enhancements, by the way. So I've not done any enhancements calculation in it. So this is your take home at the end of the month. So if you are band three NHS staff, this is what your take home will look like at the end of the month. So at the band 3 level, this is your take home at the end of the month, just £27 ahead of what you have at band 2 level. And if you are band 4, bear in mind, I am looking at outside of London, by the way. So if you're band 4, this is your take home at the end of the month, 1,800, because your starting salary will be 28,000. But the longer you stay in the role, so at the band 3, after 2 years plus on the role, this is what your take home will look like because you actually, oh, why is this coming up? Because you've actually gone on to what's it called? You've stayed in that role for about 2 to 3 years. And if you're band 4, for example, this is what your take home will look like, which I've shown you, right? Which I've shown you. Then after that, if you've been on that role for about 3 years plus, you can see this is when you get to 1,900 thereabout. And at band 5, you can already see your take home at band 5. Your starting salary outside of London is 32,000. And then you can see that your take home is about 2,040. Bear in mind, I've not said, so let's say any one of you here is on post um 2012 student loan. So that is your take home. If you're on pre-2012 student loan, that is your take home. And you can see for yourself, you will need to be about 4 years into that role in order to be reaching the 39. But bear in mind that NHS salary, you get an increment every April which is the new financial year. So you will always see that your salary will change year on year, depending on the negotiation between the government and the NHS employer. And as band 6, this is what your salary will look like. This is what your salary will look like at band 6. So those of you on the post 2012 student loan, again, always remember you can decide to opt out of the pension, which your money will be given to you. So, but that's a decision you need to make. So if you stay about 5 years into the role, that is what your salary will look like. And then you go into your sevens. Again, for those of you that are in London, the salary is slightly different. So if I am calculating for you based on where you are in London, let's say you are in inner London, for example, this is what your salary would look like. When you are in inner London, your salary, there is a salary increment. So where salary of band 4 is about 28,000 in outside of London, if you're based in the high cost living area in London, your salary is 34,000, starting salary is 34,000 for your role in those areas. So you can clearly see that for your band 4 in outside of London, you get straight away with that calculation. So the higher you go, you will see different salary requirements. So this is a band 7, this is band 8, and this is about your band 8B. So with the 8s, you have different layers in there, B, C, D, before you go on to your band 9. And you can see at levels which you need to achieve to have at least a reasonable income when it comes to your job opportunity. But you have to be very realistic about how do I get in first and how do I build on this experience in order to make progress for myself to go into those opportunities that will give me higher income as I progress with my career. And that is something I want you to be able to take on board as you are listening to me today. And I hope you found this session quite very helpful as much as possible. So let's go into some of the other aspects of it. Now, if you are international students, there are numbers of changes that have come into place and will be coming into place by next year as well, just within the next 6 months. There are numbers of changes that will be coming into place. The current immigration, you will see there's been massive changes over the months and years, and the government has probably cooled down a little bit with much focus now on the health and care workers, and let's focus on students at the moment. But for those of you that are here today, if you're looking for sponsorship, the previous rules was around the 30,960. That has moved to 33,400. And this is only applicable to those that are students. These are only applicable to those that are students, right? And not a dependent of a student. And if you're looking for a skilled worker visa, if you are a dependent, you are looking at the 38,700 before, but now this is now the 41,700, which literally is about band 7 outside of London and is about band 6 starting salary in London for you to be able to attain it. And you should also be aware that, currently the post-study is 24 months, but coming to next year, January, your post-study will be reducing to 18 months. So that is a massive 5 months taken away in terms of privilege of giving you the time to apply for jobs. So you can imagine now that the pressure is even going to be even more loud or well pronounced than what it used to be, because you've now got another 5 months less time to actually enter the job market to get yourself promoted to a job that will get you sponsored. So the pressure is on you now, and it's about you making the most of the little time you have to make sure you can get yourself into the right job. And the reason why they're doing all this is to make sure that immigrants coming in here are going into jobs that actually have greater and meaningful impact and contribution to the society. And I hope you guys can take that on board. I mean, look, these are some of the testimonials from the services, for example. I'm sure you can read that. These are people I've had opportunity to work with. Sheyi, very, very good person I've worked with. I've had opportunity to know for a time now. The same as well, Babatunde. Sheyi, by the way, gone on to become a senior learning OD straight away from a student to 20 hours and then from 20 hours to full time as well. And the same as well for someone like Babatunde Balogun, who's senior administrator as well. Knew him right straight coming out of university. This is another person as well, Naya, whom I know as well, being a pediatric medical sec, studied data sciences. And this is someone as well that studied MSc in international business with data analytics as well with advanced practice. And again, you've got someone like Kenneth, who's also a business support supervisor, someone that went to my university at Sheffield Hallam. did the same program as me in international business management. And we've got here again Bolale, who is the senior waiting list coordinator, MSc from the same university, same program as well. Sheffield International Business and Management, working as a senior waiting list coordinator. So you can see that there are success out there and there are people attaining it, going into NHS, and these are people from ethnic minorities that have had opportunity to play a key role in in their career journey. They are not people that have gone into roles like your healthcare assistants, because that is not something I want us to be going into. I want people that will be able to go into career where they can make meaningful contribution. And that is the purpose of this webinar today. And I hope you found it quite very useful and worthwhile for the moment I've been speaking to you. So thank you so much for listening. I'm now happy to open the floor for you to ask any questions. By the way, for any one of you that might not know, there is a WhatsApp platform where I usually put job advert out. If any one of you is interested in being part of that platform, you can drop your number and then you can get to be part of that platform. But there are numbers of criteria you need to meet to be able to be part of that platform. So thank you so much for listening, and I am happy to take your question. Efusa, go ahead. I cannot hear you, Efusa. I can't hear you. Okay, since I can't hear Efusa, Ngozi, Ngozi,
Hello, Fire. Good
hi,
afternoon. Hi.
hi.
My
Ngozi,
name is Ngozi.
where have you joined from?
I'm joining from Birmingham.
Which university?
I currently attend the University of Ulster.
Great. Okay, great.
Yeah, and I'm studying same as yours. Someone who did a testimonial attends the same university as me, Ulster University,
Okay,
Birmingham campus. Yeah, and I'm actually studying masters in international business with data analytics.
okay, good, good, good. Can I
Yeah,
just ask you, if you don't mind, are you an international student or home student?
yeah, I'm an international student.
Okay, all right. So
Yeah.
what's your question?
Okay, so my question is, recently I got a band three role as an office administrator
Mm-hmm.
with so it's not really I would say it's like a federation. I
Is
think so.
what?
It's a federation. I don't know what they call it. It's under the NHS. So the name of the organization is um it's Veritas, something SW Health.
Okay, okay, okay.
So
Yeah.
yeah, so they don't really, I don't think I've done like a bit of research and they don't sponsor,
Mm-hmm.
right? And honestly, one of my goals is to by next year find a sponsorship role so I don't have to take the post-study route. So I was just
Yeah.
wondering concerning, and I have a background in sociology as well. So concerning like if I consider like my background, my academic background, I don't know, is would you advise that I because I'm considering looking at healthcare analytics going into that aspect just so as to improve my chances. I don't know if you can advise me on which route to take and also like the possibilities of actually getting a sponsored role from a band three role from currently working in band three role.
Okay. All right. So that's a very good question, by the way. Um, because of the nature of the question you've asked me, and it's quite very, there's a bit of a sensitive aspect of it, but I'll try to answer it in a diplomatic way. But my best advice would be take my number. Can you see the screen? Ngozi,
Yes, I can. I can see the screen. Sorry, my
Yeah,
mic was muted.
yeah, so if you take my number, then if you give me a ring, then I can discuss what you need to do. But with respect to the question you asked me around the sponsorship opportunity, let's put it this way. I think it might be very difficult for you to assume not that you would not go down the post-study route. The reason for that is because by the time you start applying for new roles now, let's say in any circumstances now, if you get a band five within your, excuse me, if you get a band five within your area, they will not meet the salary threshold you need for a sponsorship. Because band five outside of London is about 32,000 thereabouts, which I've shown you, which doesn't meet the requirements you need for the 33,400 for sponsorship on a new entrant, if needs be. Therefore, you need to focus on specific hospitals in London that are within the high cost living areas, and that is your guys in St. Thomas's, Imperial, King's College, and those are highly competitive hospitals. University College London amongst them, Whittington, and a lot of those hospitals, from my understanding, Lewisham, for example, amongst them, rations sponsorship. Now, that being said, you will probably, one way or the other, need to get a post study. The only thing you might be able to do, best case scenario, is that you might not use more than if you get your post study before January, which you might be able to, out of that 24 months, you might not use more than, let's say, give and take, you might not use more than 16 months out of it before you get your sponsored roles within the NHS. And that will mean, you constantly move up the ladder. Before you even graduate, as I'm speaking to you, by the time you're coming close to your graduation, you might start targeting band five, at least build an experience around that band five for about 6 to 7 months, and then start aiming for a band six, start aiming for a band seven, and then you might be able to become well settled. So, but to realistically say you will not need a post study is not something that I think is achievable, or actually is something that might happen. So prepare yourself that you will need that post study, but your plan should be, all things being equal, that you will not use more than 16 months of that post study before you secure sponsorship. But if you want to discuss it further, you can always give me a ring.
All right. Thank you so much, Tayo. This was very helpful. Cheers.
No problem at all. Efosa, is your mic working now? Okay, still can't hear Efosa. Does anybody else have any question? Any question from anybody? Do you have any questions? So, like I've mentioned to you, so those of you that are here today, there's a WhatsApp group. If you're interested in joining, it's something that I will be happy to add you into, but I just need to make sure I go through the necessary criteria. There are no people with sponsorship in that group. So if you're already sponsored in health and care, you can't join that group. And if you're someone that is already coming to the end of their post study, I cannot add you into that group. So can I just ask Sunday Anytime, please go ahead.
Good day, everyone. Good day,
Hi.
Hi. Good day, everyone. Good day, the moderator, for the time taken and enlightening us more about the NHS role. Sorry, there's a NHS job I applied for yesterday at one of the care homes I've worked before, having court in South Shield, Newcastle. So I'm thinking of the probability of getting the job, because one of the shifts I did, so the manager asked me, although I wasn't aware that there is a job opportunity there, until one of the friends I made there called me yesterday that Sunday there is a job opportunity, have you applied, things like that. So I just entered the website and then applied yesterday. So I think I've worked there before and I've gathered some experience. So I don't know the probability of getting interview or getting the job. So maybe you can share more light on that.
Well, if you've worked there before and they know you, obviously, when they see your application, is it the same department or just the hospital in general? Is it the same department?
No, just the hospital in general.
Yeah, well, I mean, yeah, I cannot, if it's the same department, obviously, that gives you an advantage. But if it's just the hospital and another department, then you're just, your chances is just as 50-50 as anybody else. Can I just ask as well, are you currently a student?
But I'm done with school. I'll be doing my graduation by the next month, things like that. So,
Okay. Okay. All right. Okay. All right. Okay, so that's fine. Okay, you've got my number anyway. So if you message me on WhatsApp, then I can speak to you to also determine, because I have to go through that process before I had anyone into the group. Like I've mentioned to you, the group is only for people that are looking to get administrative job in NHS. No, I don't really do care job in there. So it's only pure administrative roles. Yeah,
okay, okay.
yeah. So yeah, like I've mentioned to you, sir, just to make mention again, I do not cater to people looking for healthcare assistant role. It's only pure administrative senior middle manager role within the NHS.
All right.
So,
So,
so anyone that wants to join the group, please message me on WhatsApp. Then when I speak to you, then I'll be able to determine. I will not be able to pick any numbers from the charts. If you can hear me, you can see the screen, pick my number there, message me on WhatsApp. Then once I speak to you, I will determine the eligibility to join the group. Um, yeah. Any more questions? Any more questions before we round up? Okay. So wonderful. So great. So like I've mentioned, just to sort of repeat again, you can see my screen. You can see my screen. If you have any question, please message me on WhatsApp and use that opportunity I will
Can you hear me?
use that. Is that a full, sir?
Yeah, this is Efosa. Can you hear me now?
Yeah, sure.
Okay, thank you. So I just quickly use my phone now. Right. So first of all, thank you very much. This is very, very impactful section. And this session even came at the time where I have interview next week as an administrative assistant in Leeds. And I sincerely, benefited a lot. I want to say a very big thank you. And presently I'm on post my graduate visa. So I think the question I want to ask is my line manager is no longer working in the organization where I finished from, right? And like you said about the reference, and this is the line manager I've worked with, you know, and so I want to ask now that my line manager is no longer working in that organization, right? And I believe the organization email, official email, has been disabled. So I want to ask for your own idea on what can I do. Is it possible to use anybody from the organization, or because I sincerely have a good relationship with my line manager, but she's no longer working there anymore. So I want to ask for your own advice on what to do regarding that.
Yeah, it's not that hard. Are you still working with that organization at the moment?
No, I'm not working there. Though I'm working there anyway. My contract ends in June. That means this month, right? So
Yeah,
yeah.
but did they still have working email?
Do you mean me or my former
No,
line?
the organization.
As a general, yeah, I think they do
Yeah,
generally.
they have HR, right?
Not really, because this is a student union, right? The student union, organization, an independent organization, right? So
Sorry, wait, it's a student union of your university.
Yes.
Yeah, they will definitely have HR. There's no student union that don't have HR.
Okay. Then we have admin. It's not named. Okay. We have admin.
No, you have
Administrator.
HR. Don't worry, you have HR. Every student union have HR.
Okay.
Yeah. So if it comes to that case, all you just need to provide them, all the best with that interview coming up. All you need to provide them when they ask you for the reference, once your line manager is no longer there, just provide them with the next available person, and then possibly either you contact the HR for the student union to help them provide the reference. At least there will be someone there that knows you. Your record is your record. The reason is your record is with someone. So all they just need to provide is, do you have any ongoing disciplinary? Do you have any sickness record? So there's someone that have all your record anyway, which is the HR, and the HR will be able to respond. Even in some circumstances anyway, if your reference were to go to your manager would have directed it to HR to respond on their behalf. So your manager leaving does not impact them giving you a reference.
Oh, okay. Okay.
Yeah.
Thank you very much. So I'll also be interested in the WhatsApp group.
Yeah, so like I've said, take my number, message me on WhatsApp, and then I'll take it forward from there. So please, again, like I've said to everyone, you can see the screen. Just take my number from there, message me on WhatsApp. The number is 07534832121. Take my number there, message me on WhatsApp. I will not take the numbers from the chat because I need to establish that is the right candidate I'm adding into the group. Because the kind of jobs that gets advertised in that group is a non-care job. They are just purely administrative at band 5 to band 7 roles within NHS. In some circumstances, band 4s as well. But it depends. Anyone that can talk to me outside of the session today, the company services, whether be it job application support with coaching, mentorship, and guidance from NHS point of view, that those are different things, like interview prep. All those things are different aspect of what I take care of. And I'm quite very glad that I've got a couple of people here today that I've had opportunity to work with. And you've also seen some testimonials for yourself. I hope maybe in future I'll start bringing in physical people again for future testimonials. So yeah, thank you so much for the time today. We're coming to the end of the session. I wish you all the best, and I wish you a very lovely weekend. I hope this one comes back out again. And to every one of you that is going back out there searching for job, whether you're a student or you're a graduate, I wish you all the very best. Thank you so much. Take care of yourself.
Bye.
Bye, bye, bye.